Morena tātou. For those of you who don't know me, I'm Sarah Verran, and as Sarah Gibbs said, you're blessed to have two Sarahs within the organisation, so that makes it really easy to remember names, I guess. I have the privilege of serving as the CE of Brain Tumour Support, and it's my absolute pleasure to welcome you to this important gathering for the third year running. Whether you're here in person or you're joining us virtually, your presence today sends a powerful message that no one affected and impacted by a brain tumour should face their journey alone. And as a community, we are here to support each other. I'd like to firstly acknowledge our sponsors. Thank you for supporting us to be here, our Medical Advisory Board, the NANOS Committee, and the conveners who have worked so hard to make a great event happen in 2026. So I wanted to talk a little bit about the year that's been, and where am I going down here? Hang on a minute. So I guess, well, before I talk about the year that's been, I wanted to talk a little bit about our organisation. So for those of you that don't know about us, we began as a grassroots initiative in 2019. It was a small group of patients, carers, clinicians and passionate advocates determined to support people so that people don't walk this path in isolation. And we have since grown into a national organisation, and we provide practical support, information and most importantly, community. So I guess, what became one person's quest for support has grown into a compassionate nationwide organisation walking along people in their whānau. So in the words of Dr. Zeus, we have a mountain to climb, but we aim to get to great places and we are on our way. So I wanted to talk today a bit about the year that's been and touch on our impact, because that's what drives us each day as to how we show up and how we provide support to people that need it at a time that is often very overwhelming and really scary. So in the past 12 months, Brain Tumour Support has provided support over to 662 newly diagnosed individuals throughout New Zealand, sending a brain box and providing first contact support. 289 people received a brain box. 519 people connected with our online support groups. 645 people were referred to Brain Tumour Support New Zealand and external support providers for information and resources. Our 3 awareness campaigns, they provide vital and successful opportunities to amplify our message. These campaigns fuel grassroots fundraising through No Going Back and our events and sales of our, obviously, Brainy Beanies and our community events. But, we only reach a fraction of the people that we need to reach, and there is much more to do, and we're committed to expanding access to support wherever it's needed. We're privileged to have a passionate community who fundraise, and our community of volunteers at last count sat at 120. So we're looking at kind of over 500 or 600 hours of volunteer support on average every year, as a minimum of the people that, connect with our organisation. We're very small. We have 1.5 FTE, and these people are central to our ability to grow and deliver impactful whānau-centred support. So we talked a lot about data yesterday and the need for data to be able to tell your story. And for us, that's an important piece of our work that we wanted to grow. So last year we were really able to capture a lot of data because we implemented a client management system. And, we know that although we're small, we actually impact and reach way more people than we think that we reach. And so this impact statement here, or this impact infographic, shares a bit of that information. you know, when we started diving deeper into that, we saw that we actually reached and connected with so many people as than we thought. And that information is a powerful tool for us to be able to tell our story and drive awareness. Remembering that some of these numbers are just first contact support. So that's not taking into consideration all of the people that we connect with on an ongoing basis. So there's been much discussion over the last day or so around the patient experience. And for us at Brain Tumour Support, we bridge that gap between the clinical setting and how the patient can access more wraparound support in the midst of an often intense and scary, isolating time. So our team are really proud of the work that we do, and here is Kim to tell you more about that. No, don't know where Kim's gone. Why can I not play that? Oh, here we go.
A brain tumour diagnosis changes a life. In a moment, everything becomes uncertain, overwhelming, and deeply personal. That's where we come in. My name is Kim Bredenbeck, and I'm a navigator with Brain Tumour Support New Zealand. I love my role because I get to walk alongside individuals and whānau facing one of life's toughest journeys, not just as a guide, but as a steady presence when things feel unclear. I help connect people to the right support at the right time, translating complex information, providing connections, showing people they are not alone and that they are being heard, because no one should have to navigate a brain tumour alone. This role is about more than support, it's about trust, compassion, and empowering people to make informed decisions in moments that matter most. I love that we create pathways through uncertainty. We do it with respect, with dignity, with understanding, and of course with hope. I've observed over time that something powerful begins to emerge. Confidence grows, isolation lessens. Our people begin to feel more equipped to face each stage of the journey, not because it is easy, but because they are supported. The impact is about empowerment, connection, and compassion. We help our people feel seen, heard, and held, and I'm enormously proud of that.
So many of you will know about our brain boxes. They are often the first touch point into our service. And, you know, we see the difference that these make every day. On the image there, you'll see the two different types of brain boxes that we offer, one for adults and one for children. They tend to have fairly standard set of contents in them, but I guess what differentiates the two is that the adult brain boxes have a set of 7 patient guides, and we get told time and time again that the information in those is really, really helpful after people have had their initial specialist appointments, because it sort of breaks down and humanizes some of the information that is really helpful then for people to be able to go away, write questions that they need to ask, and actually be able to disseminate some of this information. The children's brain boxes have got an education guide in them, amongst obviously some lovely kind of toys and things to support children. And that education guide was developed and written by some members of our board, the Ministry of Education, and Starship Hospital. So we're immensely proud of these brain boxes because they represent something that not any other charity offers in that brain tumour space. And the support and the feedback that we get from these is wonderful. In the future, we're looking to develop another service for a brain box for caregivers, because that is definitely an unmet need that we want to address. So these brain boxes, they offer a tangible and emotional lifeline. Through follow-up surveys, the people that receive these consistently say how deeply they value the information and the personal care that each box in bodies when they receive it. But we see the need increasing. We used to send 2 to 4 a week. We're now sending 6 to 10 a week. And probably for the last month, that's been sitting at 10 brain boxes a week. Whilst our numbers for children are still low in comparison to adults at about 30 children a year, and that includes children and young people, versus over 260 for adults. And since 2021, as you'll see, we have distributed over 1,200 of these throughout the country. So this is what people tell us about the support that we provide. And this is really important because we don't know that we are providing a great service if no one tells us. And we're really lucky that we get great referrals from all of the different DHBs around the country. Referrals come in from health professionals, they come in from community services, and they come in from word of mouth and how people find us online. Another important part of our work is advocacy, and this comes through the patient voice. And the quote, nothing about us without us, rings very true within our organisation. So, it's about amplifying our voice and enabling spaces to do that. It's about shaping policy and enabling people to be able to share their messages to raise awareness. We're quite active in submissions to Pharmac, Health New Zealand and the select committees, and we will continue to be so. And obviously we're amazing at putting ourselves in places where we can represent New Zealand and brain tumour support at worldwide summits and conferences, and we have Chris to thank for that. So most importantly, as I mentioned at the start, it's about building community. It's about connecting people with support to ensure they're not alone. We're proud of what we've achieved, but we know that the journey is far from over. The work ahead is complex, but it's not impossible. So not when we walk together, I guess. So welcome again. We hope you find today informative and inspiring. Thank you.